In a world where carbs are your enemy, you need one man to help you fight your battles. That man is Jimmy.
Combating nutrition disinformation and general bull. It's Jimmy Rants. JimmyRants.com.
Are you concerned about what keto will do to your cholesterol? Many people believe eating fat, especially saturated fat, will raise their cholesterol levels and put them at a greater risk for developing heart disease. And doctors reinforce this by making a big deal about high cholesterol requiring a statin medication to lower it. But this is half-century-old thinking. Newer research shows triglycerides on a standard lipid panel are a much better indicator of your current state of heart health. These blood fats are the truly bad cholesterol that are a direct reflection of your carbohydrate intake. Aim for triglycerides under 100. Cut your carbohydrate intake, eat more real food fats, and your heart will be happy and healthy.
Simplified short-form keto videos found exclusively at ketowhiteboard.info. Watch it, share it, live it.
What's up, you guys? Welcome back to another Instagram Live, and we're here with another episode of Jimmy Rants. JimmyRants.com is the website, and we have 3 ways you can access this show. It starts off on Instagram, so go follow me there at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, you can engage live in the content, just like Elvira, Keto Coach Lauren, all these people coming in right now to watch this live. If you missed the live, you can watch it on replay for up to 24 hours, but after 24 hours, it does disappear. We throw all the past episodes up on YouTube, so do a keyword search Jimmy Rants on YouTube or Google. You will find the show. Finally, the best of the best moments of this here show in podcast form are on the Jimmy Rants podcast over on Apple Podcasts as well as Stitcher. Go leave us a review on Apple Podcasts, by the way. Really helps out podcasts when you do that. JimmyRants.com is the website. Today's Jimmy Rants is all about a brand new cholesterol lowering drug. So those of you that have had high cholesterol when you've gone to see your doctor, the doctor has very often written a prescription for a classification of drug called a statin. So statins are known commercially as Lipitor, Crestor. Those are kind of the biggies. And I've taken both of those in the past before I went keto. And they are meant to lower your total cholesterol by basically shutting off your body's ability to produce LDL cholesterol. And supposedly by the lowering of the cholesterol, it makes you more heart healthy. That's the theory. So they now have come out, you guys, because so many people have complained about the side effects of statin medications, some of which I've actually experienced personally: muscle fatigue, muscle aches. You really just feel like you're 100 years old. It's really a horrible feeling when you take statin medications. You start to have memory problems happening. You really feel like you're aging, and you actually probably are taking these medications. So they, in the science world, have tried to come up with a better way to lower your LDL cholesterol and to thus try to make you healthier with your cardiovascular health. So here is the news story that I'm going to be reading from. New cholesterol lowering drug could be an alternative to statins. Many people want to lower their bad cholesterol, can't tolerate all those side effects from statins, so a brand new drug could help if it's approved by the FDA. So it says a new type of cholesterol lowering drug was well tolerated by patients and led to a, quote, significantly lower, end quote, levels of LDL, which they describe in this news story as the harmful type of cholesterol. and it just underwent a year-long trial, according to the researchers. It's called Bempedoic acid. You take it as a daily pill, and it could be an option for people where statin therapy wasn't helping, or who don't tolerate the statins. So what I want to talk about here today, you guys, is yes, we have this brand new alternative for lowering your cholesterol that is not a statin drug. But guess what? Statin alternative bempedoic acid is still all about a failed hypothesis when it comes to the relationship between cholesterol and heart disease. And they're going to beat this drum to death, you guys, I guess until the cows come home. Because the notion that your cholesterol level has anything to do with your heart health has been thoroughly debunked. I wrote a whole book about this, by the way, called Cholesterol Clarity, What the HDL is Wrong with My Numbers. Go check it out, cholesterolclarity.com. Will take you right to the Amazon page if you want to learn more about this issue of cholesterol. But when I was writing that book, statins were kind of the big moneymaker. They were making $29 billion a year, all under this guise of making people more heart healthy, when they were doing nothing of the sort. And yet they've been put out there for so long. Well, now that people are starting to have more problems with tolerating statins, and oh yeah, by the way, all of those patents that allowed Lipitor and Crestor and all these companies to make gobs and gobs of money, the patents have run out. So now they're looking for a way to create another new drug that will earn them billions upon billions of dollars more, all under this guise of lowering your LDL as a means for making your heart healthier. It's just not true. And we've talked about that ad nauseum. People still worry about their freaking cholesterol. And it's just amazing to me, with all that we know about the relationship of cholesterol levels to your total heart health, all that we know, that there is no relationship between those two numbers, and yet people still want to harp on this. And this new drug, if you're just joining us, we're talking about this brand new alternative to the statin drugs. It's called bempedoic acid. And it's a brand new drug that's designed to be a daily pill that would lower your LDL cholesterol levels even more so than statin drugs, and apparently does not have the side effects such as muscle pain. The problem, guys, is it's so brand new. Yeah, they've been in trial for the past year, but it's so brand new, they don't know all the ramifications of even that drug yet. But let's get into more of what this does. After 3 months of taking bempedoic acid on top of statins, so they not only had them on statins, but they added this bempedoic acid with the statin, patients saw their LDL levels drop by an average of 18%. All right, let's do some hard numbers. So let's say their total cholesterol was a dastardly high 300. I'm just going to do that to make the math easy. So if their total cholesterol was 300, and they took a statin drug like Lipitor or Crestor, and they dropped by an average of 18%, then the average lowering of your cholesterol went down by, 54 points. So it went from 300 to 246 with a statin and with this new drug. Is your doctor going to be happy about that? I don't think so. Most doctors want you to have it below 200. A fake number, by the way. There is no reason why your cholesterol needs to be under 200, artificially pushed down that way. If it's naturally there, fine. But we don't need to be artificially with medications trying to push our cholesterol levels that low. So this was a new study that was published in the New England Journal of Medicine that talked about this. The trial was funded by Aspirion Therapeutics. It's a pharmaceutical company seeking approval from the FDA to make this drug. Yeah, Aspirion Therapeutics is hoping they see billions in their future. if they think that this will become something that is used by doctors. Bempedoic acid works, check this out, you guys, in the same pathway as a statin does, but at a different site, according to a cardiologist who is the lead study author. His name, Dr. Kaushik Ray. He's also a professor at the Imperial College London School of Public Health. He notes that it blocks a key enzyme that the body uses to make cholesterol. Does anybody ever stop to think about why our body has enzymes that create cholesterol? Does anybody ever think about why that enzyme and other processes in the body work the way they do? Why does the body create cholesterol? Man, that's a loaded question. There's a whole lot of reasons why. But one of the functions of cholesterol is to deal with inflammation in the body. And so if you're trying to lower your heart disease risk, don't you want something that's going to help deal with inflammation? Because it's inflammation that actually leads to heart disease, heart attacks, and all of these cardiovascular issues that people start to deal with. So if we're cutting off and we're blocking a key enzyme, which is what this new drug, bempedoic acid, is designed to do, if you're blocking the key enzyme that the body uses to make cholesterol, what happens when you have inflammation in the body and you don't have that cholesterol to help deal with it? Oh yeah, it's going to hurt you. So we got to get out of this notion that cholesterol is such a bad, evil thing in our body. And everybody, unfortunately, apparently still believes cholesterol is the enemy. Cholesterol is not the enemy in your health. High insulin is. High blood sugar is. High inflammation is. All of these things are much more detrimental to your health than your cholesterol levels will ever be. Yet everybody worries about their cholesterol. If you're just joining us, we're talking about this brand new drug that is being and going through the vetting process with the FDA right now, all about lowering your cholesterol. And the stated purpose is for those people who aren't seeing their LDL cholesterol go down enough using a statin medication, and or if they're taking a statin and they're getting the side effects, this brand new drug called bempedoic acid is supposed to give you all the benefits of a statin except without the side effects of the statin. And they've done this study that got published in the New England Journal of Medicine that said when they combined a statin with this bempedoic acid, it's lowered their LDL levels by an average of 18%. So we talked about if you had a total cholesterol of 300, that brings it down 50-something points. Are you really giving them benefit? What is that doing? What is it supposed to do? So we're learning the mechanism of this is all about blocking a key enzyme that the body uses to make cholesterol. And I'm asking out loud, why are we messing with Mother Nature? God didn't create that pathway for our bodies to create cholesterol for no good reason. It's pretty fascinating. Let's keep reading. We've got a number of different studies now that have shown that it looks to be yet another really good option. This is the lead researcher talking about this new drug. Doctors like options because patients don't fit one size, so it gives us an option for people with an unmet need. I think this is a great development. Translation by this Dr. Ray. Cha-ching, cha-ching, cha-ching. I'm going to get rich from this drug. Call me cynic. Call me a cynic. But my pessimism about this kind of thing, you guys, is based on I've been doing this for 15 years. And I have seen this kind of development again and again and again. And every single time, it's all about what can we do to put a Band-Aid on some perceived problem as a means for getting rich quick. And quite frankly, I think the patients getting caught in the crosshairs of these researchers that are hoping to develop this next drug to make them filthy rich, and the patients that are trying to get healthy, they're at odds with one another. Because you got the researchers that seemingly want to get money from the next great classification of drug. Everybody's trying to replicate the success that the statins got. Statins, $29 billion every single year in their heyday. And so they're trying to find that next great drug, which on paper will lower your LDL cholesterol. Here's the thing that they never tell you about the statin drugs. They didn't actually improve heart disease. Heart disease is as bad, if not worse, than it's ever been before. Heart disease and cardiovascular events, despite cholesterol levels being in the quote healthy range, are still happening to those people. So if they're still happening to people that are having, if heart attacks and other cardiovascular events are still happening to people that have total cholesterol levels under 200 and LDL cholesterol levels under 100, if they're still happening, doesn't that mean that the hypothesis is wrong? And yet, no, we got to keep making pills that lower LDL cholesterol. And I want to ask these researchers and all of these wizards of smart who think they know best, don't we want to see results? Where are the results? Where is the evidence that lowering cholesterol does anything positive when it comes to heart disease? And the fact is, it doesn't. They want to talk about, well, we're not really about lowering cholesterol anymore. We're really about lowering inflammation level. They try to pull that with the statins. Well, statins really work because they lower the inflammation levels, and so that's why we need to keep blah, 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 blah. And I'm like, you can lower inflammation levels quite naturally through nutritional approaches like keto or paleo and other healthy diets. You can lower inflammation levels very naturally with real whole foods. So why are we putting people on these medications, which we know the statins have major mental side effects, muscle aches? It increases your risk of diabetes. It even, ironically, increases your risk, statin drugs do, of heart disease itself. Guys, go get my book, Cholesterol Clarity, What the HDL is Wrong with My Numbers, cholesterolclarity.com, because we put all of this data into that book. And it's still relevant information. But what we're talking about here today is this new drug that's supposed to be the next statin drug, bempedoic acid. And the problem with this new drug is it's addressing the exact same failed cholesterol hypothesis that statins did. You don't have a disease called high cholesterol. High cholesterol in and of itself is not a disease. It's just not. The disease, you guys, is higher inflammatory markers. So have you ever had your HSCRP level measured? If you haven't, you need to. And what you're looking for is a number definitely under 3. Optimally, you're looking for under 1. The last time I checked mine, it was right at 1.1. So you want to have a lower level of inflammation, because here's the thing. Regardless of what your total cholesterol level is or your LDL cholesterol level is, if your inflammation is low, you can't have any disease happening in your body. Lower inflammation is the key. Now, to go along with that is lower insulin levels, lower blood sugar levels. So you want to have those things run as well. And if you don't know what those numbers are, you should know what your insulin, your fasting insulin, you should know what your HSCRP is. You should know what your A1C is, which is your average blood sugar over the past 3 months. All of these things are relevant. So let's get back to the article. LDL contributes to fatty buildups in the arteries. No, it doesn't. That's what they say in the article, but no, it doesn't. It raises the risk of heart attack and stroke. No, it does not. They're going to repeat that lie often enough. And of course, patients that read these kind of articles, LDL blocks your arteries, clogs your arteries, and it gives you heart disease and have a heart attack. I don't want to eat any cholesterol. I want to get my LDL down. I guess I should pop this pill and blah, 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 blah. It's so ridiculous. How they have so lied to us, all at the altar of making the next great wonder pill that's going to make all these researchers billionaires. Because that's what they did with Lipitor and Crestor, very famously. So now that those patents are gone, they got to come up with the next big one. And I, for one, am going to call them out here on Jimmy Rants. Heart disease is the leading cause of death for both men and women in the U.S., and lowering LDL cholesterol has become the cornerstone of heart health. Well, it doesn't need to be. To me, if you want to look at the cornerstone of heart health, it's triglycerides. What's happening with your triglycerides is going to determine where we go in our heart health. And I guarantee you, if they ever did a study looking at people that had heart attacks, almost invariably, they're going to have high triglycerides. If you look at people who develop cardiovascular disease, almost invariably, their triglycerides are going to be so off the charts high. So why aren't we tracking triglycerides? You hear them talk about LDL cholesterol. That's the cornerstone of heart health. But LDL does not track with heart disease. LDL doesn't really track with any disease per se. What tracks with disease is triglycerides. So do you know what your triglycerides are? And you want to know the best way to lower your triglycerides? All of these people that are statin apologists and now this new drug, Bempedoic acid apologists, they don't want you to know this, but one of the best ways to improve your heart health, to get that triglyceride level down, you ready? Carbohydrate restriction. The number one way to lower your triglycerides. There's no drug that will lower triglycerides nearly as well as carbohydrate restriction. So you figure out what your carb tolerance is, and that lowers your triglycerides. So for me, when I first went on the Atkins diet and I was eating about 20 to 30 grams of total carbs a day, I dropped my triglycerides down to 42. Like a champ. And see, a lot of the doctors that I've interviewed over the years, ketogenic doctors, a lot of them say they can always tell when a patient has cheated on their keto diet, because they'll get their triglycerides in line. They're like 74, 61, whatever they are. And then they come back after the holidays and their triglycerides are like 143, 179. And the doctor will go, okay, what did you have over the holidays? Oh yeah, I went off plan for about a week or two, but I'm back at it now. So it will show up in your triglycerides, you guys. And heart disease and other heart health issues, cardiovascular issues, will show up not just in your inflammation markers, but in that triglyceride. So if they're trying to create a drug, another drug to be an alternative to statins that's basically going to work in the same pathway except without causing the muscle aches, simply by lowering LDL cholesterol, they're not dealing with the problem. They're not getting to the root of what's going on here. When diet and exercise don't work, well, they do work if you actually do them. What they're talking about, diet and exercise, is a low-fat, high-grain diet, and exercise, walking on a treadmill, reading a magazine, watching Dr. Phil. That's what they're talking about. I would say diet and exercise would be a ketogenic diet that's mostly real whole foods, healthy fats, and exercise would be HIIT training, weightlifting, that kind of thing. That will work. But when diet and exercise don't work, meaning the failed low-fat diet and the walking on the treadmill that never gets your heart rate very high, those things aren't doing anything. Of course they won't work. Find another diet and exercise. But no. They want you to use a medication. Statins, drugs that interfere with the production of cholesterol, can be the simplest and cheapest treatment. They're known under brand names like Lipitor, Zocor, and Crestor. They become the most widely prescribed drugs in the world. Yeah, because all of the brainwashing that has been done to both doctors and patients. Doctors have been led to believe that cholesterol is the grand enemy in your heart health. Patients have been led to believe that lowering cholesterol is paramount if you are going to get your heart health in order. So it's a recipe for multiple billions upon tens of billions of dollars being earned, all under the guise of making people heart healthier by taking a pill. What did we do before we had statin medications? How did people survive? Because here's the thing, we don't have a statin deficiency. We never have. We don't have a bempedoic acid, which is the brand new, supposedly heir to the throne of statins, deficiency. We don't. People survive because high cholesterol is not a disease. I will shout it from the mountaintops for as long as the good Lord gives me breath to breathe. High cholesterol is not the enemy. I hope you're getting that here today on Jimmy Rants. 10 to 15% of patients report side effects, most commonly muscle pain, weakness, and cramps from statins. So many people simply stop taking the pills. Actually, that 10 to 15% is on the way low end of the statistics. Most of the statistics that I've seen, and you can actually look up statin side effects as a Google search, you're going to find all kind of websites with people just screaming from the mountaintops what these statin medications are doing to them. And it's probably closer to 60 to 70% of the people that take statins not tolerating them well and having some level of muscle pain, weakness, and cramps, and far worse. There's this one guy that I interviewed for Cholesterol Clarity, and he's actually dead now, unfortunately, but Dwayne Gravelin, he was a medical doctor who had high cholesterol, so his doctor put him on Lipitor to try to help him lower his cholesterol to make his heart healthier. Well, he developed this condition called myasthenia gravis, and it literally crippled him so much so that he ended up in a wheelchair and he died simply by being on Lipitor. No lie, you guys, for 1 month. He was on Lipitor for 1 month, and that pill so poisoned his body that it led him downhill fast. And I remember when I did the interview for Cholesterol Clarity with Dr. Gravelin, he was so frail even then that I couldn't even conduct an audio interview. I had to do it all by email. I think he had an assistant typing out what he was saying. It was sad, and it's still so sad that all of these damaging effects of this FDA-approved drug, Lipitor, all of the damaging effects, nobody cares. Nobody's taking any mind of. And the same's going to happen with this bempedoic acid. We're going to find out if this becomes approved by the FDA and they come up with some bamboozle, drug name for this, and they start selling it, and your doctor, oh, bempedoic acid, it's the next great thing in lowering your cholesterol. And we find out 3, 4, 5 years down the road, in the midst of them making billions upon billions of dollars, that this starts to make your brain die off slowly. Oops. This stuff happens on a daily basis, you guys. And to me, it's better for you to know now so that you don't get sucked into this belief that you need a drug like this. The new drug, once converted into its active form in the liver, can't leave the liver cells, so it doesn't enter the muscles, making muscle-related side effects less likely, according to the lead researcher. Okay, great. So this new bempedoic acid doesn't cause the muscle aches and pains, but what else is it doing? Dr. Ray, that's what I want to know. You haven't vetted that fully out. And see, a lot of people, they are under the assumption that if medicines make it to the marketplace and they get approved by the FDA, they assume that all of that heavy vetting of what the drug is and all the various side effects that it could possibly have, that they assume all of that has happened. But the truth is, once a drug is on the market, yeah, they've done some short-term trials, like this one has had a 1-year trial. That's very short-term for a drug. Once they're out there on the market, people think they've been fully vetted. But here's the thing. They come on the market. You're now the beta tester. So if physical things start to happen to you, which is what happened with the statin medications, they put them out there, the FDA approved them, and all these people started reporting the muscle aches and weakness, and then they started actually researching it a little further, and they found that you got a further increase in diabetes risk, heart disease risk, cancer risk, all of these dastardly things with statin drugs, and yet they still had them out there, and they do some really horrible things to the body, you guys, that they're just not telling people. A good candidate for this new medication, bempedoic acid, would be someone who has a high risk for heart disease and yet still has high LDL despite taking the highest dose of a statin he or she can tolerate. High LDL is not the problem. This is a recording. High triglycerides, high insulin, high blood pressure, high inflammatory markers. These are supposed to be the most educated people in the entire world when it comes to cardiovascular health. Why does a layperson like Jimmy Moore have to teach them how stupid they sound? Seriously. This medicine could help a lot of people. We hope that we can help more people get their LDL levels to a very safe and healthy level. It's not about that. One more piece of information about LDL. So what they're referring to is the LDL-C. So when you get a standard cholesterol panel run at your doctor, you get back HDL, LDL-C, triglycerides, VLDL, and total cholesterol. That's what's on your standard lipid panel. LDL-C, a lot of people don't realize this, and I've shared this on other Jimmy rants before, but it bears repeating again and again and again because people still worry about their LDL. LDL-C on your standard lipid panel is merely a calculated, estimated number. So what they do is they take your HDL cholesterol, which they do directly measure. They take your VLDL, which VLDL is basically your triglycerides divided by 5. And then they run it through this equation that estimates what your LDL cholesterol is. But here's the problem, especially if you're on a ketogenic diet or some other lower carb type of diet. When you eat low carb and when your triglycerides fall below that 100 threshold, and when you're eating more fat in your diet like you do on paleo, Whole30, keto, all of these diets where you have more fats, and your HDL cholesterol is higher, above 50. So you know this already. If your triglycerides are under 100, your HDL is over 50. You know if your numbers are there. Guess what? It miscalculates your LDL. So that LDL-C might look exaggeratedly high when it's not actually that high. So see how they can manipulate this, you guys? So if you eat keto and you have a higher cholesterol level, especially in your LDL, which then shows up in your total cholesterol because you have high LDL and obviously high HDL, a good thing. When that happens, your doctor's going to raise a conniption fit. But you're not less healthy. They're looking at a marker that has merely been calculated, estimated. So the next time you go to your doctor as a keto dieter and he tries to push a statin medication, or maybe this new bempedoic acid, when it comes to the market, tries to push this on you to lower your LDL cholesterol, you can confound his brain if you tell him, you mean that calculated estimated number using the Friedwald equation? Yeah, no. You would freak out your doctor if you shared that information. If he's truly worried, you can run a more advanced lipid profile, which shows the breakdown of that LDL, because that's the key here. So that test is called an NMR lipoprofile. Okay, NMR lipoprofile. You probably should get it checked just to see where you stand. And what it does is it gives you two numbers that you want to know about. One is the LDL-P number, which is the total number of LDL particles. The other one is the small LDL-P. And it's the small LDL-P, like your triglycerides, that you want to have as low as you possibly can. Because if you have a low small LDL-P count, your risk of heart disease, your risk of having a heart attack is extraordinarily low. And it's that small, dense LDL that truly is the bad LDL. The problem is they lump together the good LDL, which there is good, with the bad LDL, and they scare the bejeebies out of patients, making them think that they used to have to take a statin medication, and now they're going to try to push this new medication, bempedoic acid, because it's better than statins. And it's really not. It's just falling into that same failed category of classifications. So they've been testing this new drug, bempedoic acid, for the past year. It involved 2,230 people, mostly white men, who were on average 66 years old. They had a mean LDL cholesterol level of about 103 at the start, which is supposedly sort of kind of at the healthy range. More than 97% of them had a history of atherosclerotic cardiovascular disease. In other words, they had a previous cardiovascular event of some kind. Okay? Now, here's the other thing about statins, and probably this new one. They're going to try to tout it as a preventative measure for heart disease. And yet, even in their own trial, they admit that 97% of the study participants have already had some kind of a cardiovascular event. So again, if they try to put you on this medication, how many of you have taken statin drugs or some other cholesterol lowering medication and you've never had a heart attack? How many of you have taken these drugs thinking it's supposed to be protective of you ever getting a heart attack or having heart disease? Yeah, we all did. When I started taking, I took Lipitor and Crestor because the doctor was worried about my 240 something cholesterol, even though I had never had a cardiovascular event. Now, I do have a family history of heart disease. I've talked very openly about my brother Kevin and my dad and my grandfathers all having big events with this. But as a preventative measure, these drugs, including this new one, bempedoic acid, have not been studied as a preventative measure, only in people that have already had some kind of a cardiovascular event. 97% of these mostly white men in this study of this new drug. 2/3 of the patients were assigned to receive the bempedoic acid, and the rest had a placebo. All of them continued with the high intensity statin regimen that they could tolerate. Here's the thing, guys. They're touting this as a replacement for statins, but in the trial, they didn't replace the statin with this bempedoic acid. They added bempedoic acid to the statin. They haven't tested this all by itself to show that it does a damn thing for your body in a good way. Man. The main reason for doing this is when you work through the same pathways, there's always the question, if you're going to add it on top of a statin, have you maxed out the system or do you get further incremental gain? So I thought the whole purpose was to replace the statin because people were having side effects from the statin. But guys, you're hearing them right. They're not only adding in this brand new drug, but they want you to keep taking that statin medication that's giving you all of those problems and the muscle aches and pains and the increased risk of diabetes, the increased risk of cancer, and yes, the increased risk of heart disease itself. All of those things, and then the memory issues, and then like Dr. Gravelin dealt with, myasthenia gravis, which aged him very quickly. Guys, this is not good news. Especially all under the auspices that it's supposed to make you heart healthier, but as we've talked about, it's lowering LDL, but that is a failed hypothesis when it comes to cardiovascular health. Thoroughly debunked. So they're creating another drug that's going to do something that does nothing for your heart health. Most people taking the new drug saw their LDL cholesterol drop about 19 milligrams per deciliter on average. Seriously? 19 milligrams per deciliter? So if your total cholesterol is 246 and you go on this drug with a statin, it drops it 19 milligrams per deciliter. You're still in the unhealthy range. Then what? Then what is the doctor going to do? Well, you obviously haven't done a very good job of lowering your total cholesterol, so we're going to have to do multiple drugs to try to get this down because you're in a really unhealthy state. Guys, this is nothing but a smokescreen. I hope you're seeing that. And when these drugs get proliferated, you're going to see all kind of ads out there promoting bempedoic acid. Of course, it'll be under some fancy schmancy drug name, and they'll have a cutesy little ad to promote it. But this is nothing more than more of the same that we saw with the statin medications. The new drug was tolerated as well as the placebo. There was a small increase of gout. All right, so your big toe is going to be sore because of this. Oh, yeah. Oops. That's what they know about now. What else is it going to cause? What else is going to happen? We don't know. They haven't vetted it out. So then they talk about some people who have tried Lipitor for the high cholesterol. One person is a male, 71 years old, and was getting leg cramps from statins. He said, I needed a relief from the leg cramps because it was constant. His dosage of Lipitor got lower, but it didn't bring his cholesterol numbers down to where they want to be. And so his cholesterol dropped with this new medication, and he did not have any side effects. He says, hopefully it'll be an affordable medicine that will keep my cholesterol in the range that it needs to be. Oh yeah, that's the other thing. This new drug ain't going to be affordable. Now, it may be paid for by insurance, kind of like Lipitor and Crestor were, so that it keeps it affordable to the patient. But these drug companies are going to make hand over fist money from this new drug. And this Jack Manley, the 71-year-old guy that was in the study, talked about having the side effects. He's 71 years old. It didn't say in this story what his total cholesterol was, but if you are in your 60s, 70s, or 80s, they looked at this, you guys, in traditional cultures that were free from heart disease. You want to know what the normal total cholesterol levels are of people in these traditional cultures free from heart disease. Normal, when you get in your 60s, 70s, and 80s. Any guesses? It's 300 total cholesterol. 300. So if a 300 total cholesterol is normal as you get older, which stands to reason, when you get older, inflammatory issues are bound to pop up. And what the cholesterol is doing, the reason it's being pumped out, is to deal with that greater inflammation in the body. So you want higher levels of cholesterol as an older person, just like this Jack guy that's 71 years old that was on Lipitor and was a part of this trial of this new drug, bempedoic acid. He wants his cholesterol higher because guess what? You're a sitting duck. If the inflammation starts to overtake your body and you don't have those firefighters, which is what cholesterol is, to put out the fire being the inflammation that's in your body. This is not good news. There's going to be a lot of people trumpeting this new wonder drug for lowering your cholesterol without the side effects of statins. But the honest truth is, this is not going to help make people healthier in their heart. It's not known how much bempedoic acid would cost if it is approved to the U.S. market. Yeah, they don't want you to know. But it would likely be less expensive than the PCSK9 inhibitors that are injectable cholesterol-lowering drugs. They're potent, but they're about $3,000 a year. Besides providing a boost to statins, bempedoic acid could be taken on its own or in combination with Zetia, a medication that prevents the absorption of cholesterol in the intestines. Here's what's going to happen, you guys. They're going to take Zetia, they're going to take Lipitor, they're going to take Crestor, and they're going to mix it with this new bempedoic acid. Oh, we have a new version, new and improved statin. It's not as bad as the statins. We know you've heard bad things about statins. That stupid Jimmy Moore keeps railing about statins. It's in chapter 5 of Cholesterol Clarity. You don't want to find out about statins. They're really bad news. We have a new drug that's all better than statin medications. Bempedoic acid is the key ingredient, and bada bing, bada boom, your cholesterol woes are all over, and your heart health is better as a result. Hogwash. Hogwash. But guys, they're going to get away with this. And they're going to be able to make billions upon billions of dollars off of this new medication that's supposed to lower your cholesterol when cholesterol is not the enemy in your health. I'm going to keep saying that till I'm blue in the face, you guys. But people worry about their cholesterol when there's no danger from high cholesterol. An ongoing trial is testing even longer-term safety and whether the new drug has any effect on heart disease. They don't even know if it actually has any effect on heart disease rates at all. They don't know that. They haven't studied that. And yet they want to put this on the market and let you be the beta tester? Guys, open your eyes. Now, you guys have because you watch Jimmy Rants. But in general, what are we doing as a culture if we buy into this pill for every ailment nonsense? And in this case, it's extraordinarily obvious. They haven't fully vetted this drug. And we don't even know about all the side effects. And they don't even know if it actually has any impact on heart disease levels one way or another. All they do know is that it lowers, in conjunction with a statin medication, it lowers your LDL cholesterol by 18%. That's all that they know. Is that making you healthier? Are you better off taking this drug than not taking this drug? They want you to believe that just singularly because it lowers LDL cholesterol, even that minuscule amount, singularly, they want you to believe that it's a good thing. But I'm here to tell you, it's not. Previous medicines have shown promise in improving your cholesterol numbers, but only to find out that they fail at actually reducing the number of heart attacks and strokes. Then why in the world is this a news story today? Why in the world do I have to rant about this stupid new drug, bempedoic acid, when we don't even know if the stated purpose of it is to lower cardiovascular events, to lower heart attack and stroke risk? If we don't even know that it does that, why are we even entertaining this as an option for FDA approval? I hope the FDA grows some kahunas here, because there's no business for a drug like this being put out there on the market when LDL cholesterol lowering is the only effect that we know. We don't actually know that it lowers heart disease and stroke risk. And the reason why it doesn't lower heart disease and stroke risk is because LDL is not the problem. High insulin is the problem. High triglycerides is the problem. High inflammation is the problem. Why don't we point people to ways that they can lower their insulin, lower their inflammation, lower their blood sugar? All of these things, oh yeah, by the way, a ketogenic diet helps with. All of these things would make you far healthier than taking this drug all day, every day for the rest of your life. All right, guys, so that is what's going on with this new statin alternative, bempedoic acid. They're still focused on a failed hypothesis as it relates to cholesterol. They think still, this is like decades old thinking, you guys. LDL as the marker of your cardiovascular health, newer research and scientists are all looking at triglyceride to HDL ratio. Even those that look at like total cholesterol to HDL ratio. I don't agree with that one, but that's even a newer marker than just looking at LDL cholesterol. Triglyceride to HDL ratio is so important, and yet this drug doesn't really acknowledge that at all. All right, I'm very anxious to see what you guys have to say. Welcome in, welcome in. If you're one of those people that worries about quote unquote high cholesterol, I hope this was helpful to you today. Downtown Vapor says hashtag Big Pharma greed. Yeah, they're always looking to make some wonder drug. And I think the fact that statins were so overwhelmingly in the history of medications, statins are by far and away the biggest seller they've ever had. And they're trying to replicate that. So if they can replicate it with another drug that supposedly improves your cardiovascular risk and cardiovascular disease, they're going to try. Alberto said, they said statins are anti-inflammatory, but it's because the inflammatory marker is lowered or because the damage is being repaired. Well, it's a lot of things. But they say it's anti-inflammatory because inflammatory markers actually do go down. But here's the thing, you don't need a drug to make inflammatory markers go down. you can lower inflammatory markers simply by changing diet and lifestyle. So we know a ketogenic diet is an anti-inflammatory diet. We know doing some various biohacks, things like ice therapy, infrared sauna, and those kinds of things lower inflammation as well. So yes, a drug does it. Helps to lower the inflammation, like statins helps to lower inflammation. But there's better ways to do it without having any side effects whatsoever. Is it ever appropriate to take this and other statins, Life and Picks? I would ask you the question, why? What would be the purpose in taking a statin medication? The only instance where I think a statin may be necessary is if someone is unwilling to change their diet and their lifestyle. So that's stupid to me, by the way. If you've got a risk of cardiovascular health issues, don't you want to do anything that you can to prevent that from happening? So if someone's unwilling, and I actually interviewed Dr. Jeffrey Gerber up in Denver, Colorado. He's a ketogenic doctor. And I asked him that question, who would you put on a statin? He said, really, about the only people that I ever put on a statin is when I explain the diet and they refuse to go on the diet. I put them on that drug to try to mitigate the effects of their crappy diet. And to me, that's no way to live. Two-time heart attack survivor here says 3 free minds. Thank you for sharing. And doing anything that you can to lower inflammation is going to keep you from having a third, that's for sure. I removed myself from statins several months ago. Good for you. Well, I'm hoping that you found some nutritional and lifestyle things that are helping you with that. Alberto says every time a patent is expired, they try to create a variation of the exact same drug to reset the clock. Yeah, people don't realize this, but when a medication classification like a statin, for example, comes out, they have 10 years to cash in before it becomes a generic. Well, here's what happens. As it gets close to the end of a patent period, they try to make some little tweak to it. So they'll add one little element, new element to it. They tried to do this with statin drugs because one of the things that statins do is it depletes your body of a key heart health element called CoQ10. And so they tried adding in CoQ10 to the statin, some of these variations, and tried to pass it off as a new drug. And of course, it didn't pass the muster. They're like, well, yeah, you're depleting CoQ10. So if you're adding it in, you're not really changing anything too much to it. But Alberto, you're exactly right. But guys, they get 10 years. So this bempedoic acid, if the FDA gives it approval to be sold as a medication, the clock is on, and they got 10 years to make billions upon billions. And like I said, the statins made $29 billion annually during their 10-year reign. Welcome in, welcome in. Let's see what else. Shout away, says Sassy Keto Nurse. Yes, that's kind of what I do here on Jimmy Rants. Recommended daily intake of statins, 500 milligrams coming soon, says Alberto. Yeah, not in the Moore household. Val says, I had the worst pain when I was put on statins. My mother-in-law has pain but refuses to believe me when I tell her it's her statins. Yeah, when I came out with Cholesterol Clarity, we had a neighbor that was on a really high dose of statins, and she was having constant aches and pains in her body. She read Cholesterol Clarity, and after reading it, she went off of the statins, and within a week, all of her muscle ache and pain went away. She thought it was something else going on. And when she asked the doctor about it, the doctor's like, well, I don't know. I don't see any problems. I don't see anything going on. Doctors know about these side effects of these drugs. They ignore it because they're getting some kickbacks from these pharmaceutical companies to promote these drugs. And so if they start putting out the notion that these drugs are causing some kind of pain in their patients, that's going to hit their pocketbooks. I hate that it always comes back to money, but it always comes back to money. The pain in the muscles was not because of the depletion of CoQ10. Yeah, Alberto, it probably is, among other things. I just want them to admit that total cholesterol is bunk, says Sassy Keto Nurse. They're never going to do that. There's too much money to be made in the high cholesterol is a disease lie. Higher levels of cholesterol actually beneficial later in life. Exactly. Ashton says, I was on statins for years. When I found out how bad they are, I will never take them again, even though my doctor keeps pushing me to take it. My fatty liver disease is reversed and I have better mental clarity. Exactly. Where do I find a full list of blood work tests that I should look for? I'm a 2-time heart attack survivor trying to get well. I want to see where I'm at. So 3 free minds. I have all of those tests as well as a full description of why you want to run those tests in my book, Cholesterol Clarity. So go to cholesterolclarity.com and you can see all of that. Good morning. Good morning. My doc won't do the NMR lipoprofile test, even though I told them I was doing keto for over 2 years. So MP Laughlin, if your doctor is unwilling to run a test that you want, you may have to do what I did. I fired my doctor and I've still not found a brand new doctor. I've obviously have access to a lot of different doctors with what I do, but what I do now, whenever I want to run a medical test, I go online. And there's only about 4 or 5 states where you can't do this. So I don't know where you're located. But if you go to anylabtestnow.com or privatemdlabs.com, that's what I use. You can type in pretty much any lab that you want to have run, including the NMR lipoprofile. I want to say the NMR is about $150 to run. If you have a health savings account, it'll actually pay for these tests that you run, but you order the test, they send you requisition papers, you go down to your local LabCorp, which they give you the address to go to your local LabCorp office, they pull the blood, and then within a few days, you get an email that has your results of pretty much any test you want to have run. And so you could run this yourself. It will cost you out of pocket unless you have a health savings account, but it's certainly worth it if you want to know where you stand. This sounds like it was a poorly done study and the FDA is approving it. Well, Rebecca, we don't know. It's going through the FDA approval process now. But yeah, I mean, they're taking a statin medication and they're adding this bempedoic acid to it. And they're seeing an 18% decrease in LDL cholesterol. To which I say, whoop-de-freaking-do. Doesn't really tell you anything. And they even admit in the paper, we don't know what this is going to do side effect wise, other than they already are seeing gout increase. We don't know what it's going to do actually to lower your risk of having a heart attack, a stroke, or some kind of cardiovascular disease forming. They don't know. So in light of that, why are we even entertaining this until they find out those answers? Keto Good Food says, if triglycerides are low, are LDL particles always good? For the most part. So that's a good question. People are like, well, do I need to run that NMR to find out if I have the small dense LDL particles are higher or lower? If my triglycerides are low, will my small dense LDL be low? Most of the time, yes. But sometimes it's just good to know where you stand. So running that. But yes, get your triglycerides as low as possible. Under 50, you can almost guarantee that your small dense LDL particles are basically nil. So thank you for that question. That was a really good one. Why is everything so backwards, it seems? I can't understand why the medical field allows this just for money. Yellow-eyed one, I've been asking myself that question ever since my eyes were opened to the low-carb message. And it seems to me that they put on this front that they're about health care, but what they're actually about is keeping you just sick enough so they can make money off of you, but just well enough that you don't die so they can keep making money off of you. Man, I hate being cynical. But guys, that's where I'm at. That's where my brain is right now because I've seen it so many times. That is changing though. Let me be optimistic because I do try to encourage you guys on these Jimmy Rants too. I think that notion is changing though, thanks to functional medicine doctors, thanks to natural medicine people that are out there. I think there is this move now for more natural ways, which is where diet and lifestyle comes into play to deal with a lot of these things that these medications are being created for. But they've had a monopoly for so long. They've made so much money off of the ignorance, and I'm not saying that in a bad way. It's just we don't know. The ignorance of the patient population. We just believe what our doctors say. And of course, the doctors getting kickbacks for these drugs. It's a very sophisticated marketing scheme that they've been able to pull, but I don't think they can get away with it anymore. All right, guys, I am running out of time on this Jimmy Rants. No drugs for lowering triglycerides. That's right. Cut your carbs. That lowers your triglycerides. See, doc, as long as I have a high HDL and a low triglyceride level, ketogenic lifestyle is the only drug I'll ever take for cholesterol. It's the only one you ever need. All my inflammatory markers went down on keto, says Rebecca. Yep. Mega doses of fish oil will lower triglycerides. Thank you, Anne-Marie. That's true. CoQ10 worth taking. Yeah, after I took statins, I took CoQ10 for a little while. So yeah, it's definitely a good one to take. Proudly labeled non-compliant, says Robin, at 3 doctors. Total cholesterol 228, HDL 90, trigs 41, small LDL 115. It's better than great. Yeah, those are pretty spectacular. And they go into it, you think, to help people. Well, Ketoholic, I still think most doctors do try to help people, but they've definitely been led astray. So guys, the bottom line in this Jimmy Rant, you're going to hear a lot about this brand new drug, Bempedoic acid. Don't fall for the marketing, because it's just another attempt to legitimize the failed LDL hypothesis. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. As always, hop on over to JimmyRants.com and you'll see that we start off on Instagram. You can watch it live, just like all these people, or up to 24 hours on replay. After 24 hours, it goes to YouTube. Go find Jimmy Rants on YouTube. You'll find the show. Finally, we have the Jimmy Rants podcast on Apple Podcast and Stitcher. JimmyRants.com is the website. So until next time, we'll see you then.